5-Minute Pearls for Clinical Practice. Today we are presenting the fourth in a series of pearls that deal with how to have outstanding patient interviews. Today we are discussing open-ended questioning. Hello, this is Dr. Brian Morris, and this is 5-Minute Pearls for Clinical Practice, where you will learn the tools to provide exceptional care for your patients. This is the weekly podcast where you will be introduced to time-tested, evidence-based patient care strategies that aren't always taught in schools or training programs, but are nonetheless crucial for success in clinical practice. And each podcast episode is about 5 minutes. We are in the midst of reviewing the steps necessary to having great patient visits. So far, we discussed step 1, which is preparing ourselves for the visit, making sure that we have reviewed all of the necessary information before we enter the room, and making sure that we have the proper mindset of attention and concentration ready to see our patient. We also discussed step 2, which was preparing the environment for the office visit, making sure that the office room is conducive to the visit. And third, we discussed step 3, which was to make sure that we begin the visit by making a positive connection with the patient. Today we are on step 4, which deals with how to ask questions. How do we begin the visit? The way we do this is with open-ended questions. I remember when I started out in practice, I remember entering the room for the first time to see a patient and thinking, what are all the specific questions I could ask? For example, if I knew the patient was coming in with an ankle sprain, I had a list of 5 or 10 specific questions that I wanted to have answered. What I learned over time, though, was that you need to start the office visit with open-ended questions before you move forward to the specific closed-ended questions. We ask open-ended questions like, what brings you here today? Or what would you like to discuss today? Or something to that effect. Our goal is to give the patient the room to discuss what is most important to him or her. There are a lot of reasons why we do this. One reason is that sometimes patients seem like they're coming in because they sprained their ankle, but they're really here for another reason. Maybe their spouse pushed them, and that's how they sprained their ankle. But if we just hone in on specific questions about their ankle sprain, we could totally miss a much more important, broader issue that could be going on behind the scenes. There will be time later for us to get into specific questions, but we start the encounter with a general question to let the patient tell us what's on his or her mind. This doesn't mean that we only discuss topics that the patient brings up, by the way, but we start the visit by opening up the discussion to find out what's on his or her mind. For example, what brings you here today? As the visit proceeds, we sense how things are going. Does the patient have topics to explore? And if so, we continue to ask open-ended questions about these topics until we get to the point where specific questions need to be answered. This is the art of medicine, knowing when to transition from open-ended questions to closed-ended questions, which are questions with specific answers. Let's say that we start the encounter by saying, what brings you here today? And the patient says that he's been fatigued for a few months. We then ask some general open-ended questions to see where the conversation goes. Does he discuss stress or sleep or chest pain or his marriage? Patients have a wonderful sense to know a lot about their symptoms and their origins. Our job at the beginning of the visit is to let the patient lead us where the key information lies. Let the patient talk. Do more listening than speaking. And when you sense that you have learned the basic information and have a good sense about things, we then move into closed-ended questions. Some of these may be simple yes or no questions. Most are factual. If the patient with fatigue has led us to sleep issues, then we ask specific questions about snoring or teeth grinding or nasal congestion or acid reflux. We then spend time gathering the key information. We let our patients' responses to our open-ended questions guide the conversation to where the answers lie, and then we seek out specific information necessary to make the diagnosis. Now, this doesn't mean that we don't ask questions about topics that our patient has not brought up. We may need to do that. We rely on our clinical experience and instincts to know when and how to do that, but the key for today's step is the careful balance of open and closed-ended questions. Knowing how to master this balance is a true art. That art begins with allowing the open-ended questions to steer the conversation and the specific data-driven questions to hone in on the important points of information. In future episodes, we will discuss the specific skills necessary to balance open and closed-ended questions, so stay tuned for those episodes. In the meantime, think about how you balance open and closed-ended questions. The key is to find the proper balance that allows us to optimally gather information and help our patients. Let's keep the dialogue going. Let me know what you think of this week's Pearl for Clinical Practice. You can email me at drmorris@5minutemd.com. That's DRMORRIS at 5minutemd.com. You can post your comments and your experiences on the 5 Minute MD Facebook page. You can follow us on Twitter at Brian Morris MD. And you can visit us anytime on our website, 5minutemd.com. Let your friends and your colleagues know about the podcast and make sure that you are subscribed on iTunes. When you are subscribed on iTunes, you will receive new podcast pearls as soon as they are posted. And if you have a few minutes and you enjoy what we're doing here on this podcast, please head over to iTunes and leave us a review. Thank you so much for listening. I will see you at the next 5.